A cancer diagnosis is never easy, but at Griffin Hospital, person-centered care can help make it a little more manageable.
And here to help us is Dr. Joseph Cardinelli, the Chief of Radiation Oncology at the Center for Cancer Care at Griffin. He joins us today on CT Style. Doctor, thank you for joining us.
Thank you, Ryan.
Absolutely.
It's a pleasure to be here.
So, Doctor, at Griffin, there's kind of a different approach to cancer treatment.
Yes, Griffin Hospital really focuses on the whole person as well as the families, because it's really a family disease. So when someone comes in, really from the very beginning, we are very attentive to the social needs that they have, the emotional needs, and then we pay attention to that the entire course of time that they're under our care.
Yeah, and what are some of the ways that you're able to help with that? Because you touched on how it impacts the whole family.
Right. I mean, from the very beginning, we have the people meet with a social worker. We have nutritionists on staff. All the staff that actually provide the care are very in tune to this, so that when I see people, I do ask them about their family and what's happening in their house and their emotional state.
Yeah, so there's a personal connection.
There's a very personal connection.
I think it's great. There's also a patient care navigator at Griffin. That person kind of takes charge, would you say?
Yes.
Besides the doctor, of course.
Well, the navigator really helps coordinate some of the more social aspects of taking care of the individual. Do they need additional help? Do they need financial help? Because we can help them with things and see what resources are available. Do they need nutritional help? All these things the navigator kind of helps put together.
How about when it comes to radiation? Does that differ at all at Griffin Hospital compared to others?
Well, Griffin Hospital has taken a big step forward in radiation therapy, and we've purchased equipment that enables us to do stereotactic radiosurgery on patients.
And what exactly is that?
What that is the ability to give very pinpoint radiation to a variety of different sites. So, for instance, a lung tumor in someone that has difficulty breathing, you don't want to treat a large part of their lung, and so with radiosurgery, you can target a very small area.
Wow.
And we can also take into account the fact that the lung tumor is moving while someone's breathing.
Jeez.
Wow.
So the
technology is really advanced, and it's great that you're able to help people by having that.
And even less treatments that way?
Yes, we can give less treatment. Radiosurgery is typically anywhere from 1 to 5 treatments as opposed to 30 treatments.
I think it's so important you just know that you're not doing it alone when you're at Griffin. You have the whole team.
You have a support system. And what does it mean for you? I mean, you're able to, you literally change people's lives on a daily basis. What does it mean to you?
That's a really good question. It's very gratifying for me, and to work at a place like Griffin Hospital is really tremendously gratifying. I mean, the experience starts from the parking lot because they have music piped through the parking lot, which helps people. It's just amazing. And for me personally, I take a lot of pleasure in not only providing good medical care to people, but providing emotional support, and also just knowing that people can count on me to be there for them, and that's really important.
Sure, they're in good hands.
I try very hard. And the other physicians too, Dr. Joyce Chung works with me in radiation oncology, and there's just the whole atmosphere at the hospital, it really supports that kind of approach.
Very nice. Well, we appreciate all the great work you're doing for so many people here in Connecticut, and I think all of our viewers can agree it impacts everybody, so it's great that you're able to
family sickness, right?
help people.
All right, well, you could also log on to griffinhealth.org for some more information.